Assalamualaikum and good day everyone. My name is Siti Fatimah, and together with the team members, we have decided for our topic to be on the awareness of breast cancer. What is breast cancer? Breast cancer is a disease that happens when the cells in the breast grow out of control. But most of the time, this cancer begins from the ducts or lobules, even though it can happen to any other parts of the breast cells. And when the metastasis process happens, the cancer cells will spread to other parts of the body, which means it will no longer be called as breast cancer only. And although for most of the time, people will relate to breast cancer to women, this can happen to men as well. And for 85% of the patients with breast cancer has no family history at all. There are two types of breast cancer. The first one, it is the invasive ductal carcinoma, and the second one, it is the invasive lobular carcinoma. For both types, the cancer cell can spread to other breast tissue. And for both types of cancer as well, it can spread to other parts of the body. The symptoms of breast cancer includes lump on the breast or underarms, change of color of the breast skin or the nipples, any pulling in of nipples, any discharge or liquid from the nipples that are not the breast milk, any swelling on the breast, or any pain on the breast. So these are some of the symptoms of the breast cancer. As you may see from the screen, these are the symptoms of breast cancer. People with the following symptoms should seek physician as soon as they can. This is because different people might get different symptoms of breast cancer. Listed here are the people with the risk of getting the breast cancer. The first one, definitely if you are female. Second, with the increase of age. The older you get, the more chance of getting the cancer. And then the third one is the history. So anyone with any family history of having the cancer, or if they themselves used to have any cancer, have the high chance of getting the breast cancer. Here are some of the ways to prevent the breast cancer. Firstly, stop being alcoholic. Being alcoholic does not only give you breast cancer, it will also ruin your liver. Secondly, to have a healthy weight by being physically active. And then third, if you are a mother, you can breastfeed your child instead of giving the formula milk. Apart from that, you can also check with your doctor to have breast cancer screening tests. And then, you should also limit your postmenopausal hormone therapy, as this will increase the chance of getting the breast cancer. And last but not least, you should have a healthy diet by drinking lots of plain water, having lots of vegetables and fruits, and if possible, stop drinking the alcohol. So,
now we move forward to breast cancer treatment. First is radiation therapy. Radiation therapy is the type of radiation treatment which is also called external beam radiation therapy. Most commonly, radiation therapy is given after a lumpectomy and following adjuvant chemotherapy is recommended. This helps lower the risk of recurrence in the breast. In fact, with modern surgery and radiation therapy, recurrent rates in the breast are now less than 5%. Radiation therapy also recommended for some women after a mastectomy, depending on the age of the patient, tumor size, and the number of positive lymph nodes. Second is chemotherapy. Chemotherapy destroys cancer cells by stopping the cancer cell ability to grow and divide. Chemotherapy may be given before surgery to shrink a large tumor, and it may also be given after surgery to reduce the risk of recurrence. Hormonal therapy. Hormonal therapy is an effective treatment for ER and PR expressing tumors in both early stage and metastatic breast cancer. Blocking the hormone can help prevent a cancer recurrence and death for breast cancer when used for early stage disease. Hormonal therapy shrink the cancer and improve cancer-related symptoms in metastatic breast cancer. Targeted therapy target the cancer-specific genes, protein or tissue environment that contributed to cancer growth and survival. These treatments are very focused and work differently than chemotherapy. This type of treatment blocks the growth and spread of cancer cells and limit damage to healthy cells. Immunotherapy, also called biologic therapy, is designed to boost the body's natural defense to fight the cancer. It uses material made either by the body or in laboratories to improve, target, or restore immune system function. The following drugs are used for advanced or metastatic breast cancer. Next is osteoclast therapy. Bisphosphonates are drugs that block the cell that destroy bone called osteoclast. Bisphosphonates can be used for bone metastasis. Research suggests that it may reduce breast cancer recurrence, particularly in bone when given in postmenopausal women. And the last is the surgery. Surgery is the removal of the tumor and some surrounding healthy tissue during an operation. Surgery is also used to examine the nervy axillary nodes which are under the arm. This is the infographic of our campaign. 1 in 8 women will be diagnosed with breast cancer. Breast cancer affects women of all races, and 85% with breast cancer have no family history. We also include way of prevention, signs and symptoms, risk and factors, and the treatment. Conclusion: breast cancer disease, which is familiar among us, but still some women not taking serious of this issue. 4 out of 8 women will develop breast cancer over the course of a lifetime. There is no sure way to prevent breast cancer, but there are things all women can do that might reduce their risk and help increase the odds that if cancer does occur, it is found at an early stage or treatable stage. In order to succeed, breast cancer programs should be structured and implemented on a wide scale, preferably to fit individual communities. We must help to convey the message to a large sector of the population by enhancing the knowledge of the younger generation on the necessity and the importance of early detection of breast cancer. Our group started to spread the infographic in the early June, and from the feedback, we can see that actually this campaign are received a very good feedback. This can show that the campaign for breast cancer are a good topic among community. Our group believes if you keep doing this campaign and always spread positivity on this breast cancer issue, all women with breast cancer can be strong and feel so motivated. We would like to thank to all of people that give a good feedback on this campaign. Last but not least, we must always alert and try to prevent ourselves from early to avoid getting breast cancer. That's all for me and for our group.